Every month here on 3+U, we have an opportunity to check in with one of the doctors at Center for Sports Medicine. And typically we're talking about hip replacements, knee replacements, some leg issues. But when you think about orthopedics in the hand, that might not be a common topic. But for anyone out there suffering with something called Dupuytren's contracture, you know quite well the importance of being an expert hands, pardon the pun. So we're very glad this morning to have Dr. Bob Mastey join us, talking about the advances made in this condition, which really, as I understand it, Dr. Mastey, can begin as early as even your 50s, and then for decades you're living with this, right?
That is correct, and for some unfortunate people it even starts earlier, in the 30s.
I share with you, my mother has this, my oldest brother has this, so there is a genetic link, isn't there?
Yes, there is. In 50% of all cases, there is a genetic link. It's you see it in uncles, grandfathers, and it's not necessarily may skip a generation. So 50% have a genetic link. There's someone who can say, hey, I have a grandfather, I know someone that has that in my family. The other 50%, they don't. It just comes on sporadically.
There are probably some people watching us this morning who are saying, what in the world are they talking about? Although now there is a lot of publicity about it, commercials on TV recommending different treatments, but you provided some images. Am I right that kind of the initial symptom of this begins with that pinky finger tipping down?
Well, the small finger, actually it's the ring finger is the most commonly involved, but followed by the small finger. What you'll see in the beginning is small pits and thickening pits in the palm and thickening in the palm leading into one of the fingers. The small finger is number 2, the ring finger is number 1 involved, and then over time, these cells that invade the palm and into the finger will lay down collagen. That collagen will get thicker and thicker and causing those bands to form. And then eventually those cells actually die. And just before they die, they contract. And it's like a little muscle component. So that's where the Dupuytren's contracture, the name of the disease is Dupuytren's contracture, because your fingers contract. And that can be very disabling. Handling objects, putting your hand in your pocket, washing your face, it's very annoying. In the beginning, it's not very painful, although some people do complain of discomfort when it first arrives, but over time it's not painful, it's just annoying.
Right, and it definitely interferes with the quality of your life because more and more fingers become affected, and now it's difficult to maneuver. So you mentioned collagen, and we hear a lot about collagen injections. The syringe and injection that we saw, is that what it's doing? Is it helping to regrow that cartilage? I guess I use...
So it's collagen.
Okay, yeah, I realized I use interchangeable words.
What happens is you have these cells called myofibroblasts. I'm not going to... But these cells, which are found in scarce places in the body, like the umbilical cord. For some reason, they migrate into the palm, and they just multiply. And we're not sure why it happens, but it does happen. It can happen in the feet. It can happen in the perineal area of men. Men could be affected, and the feet, and it's all the same process. These cells multiply, they lay down collagen, and then the cells die, and there's a contracture. So if it's in the foot, it's called Lederhosen disease. And the other part, it's called Peyronie's disease. That's starting to get a lot of play now on TV. And then Dupuytren's contracture is in the hand.
So, okay, so with the collagen, forgive my misspeak earlier, is the typical treatment for this then, Dr. Mastey, injections, or is there ever a surgical need?
Well, the surgical treatment was the standard for many, many years. And more recently, over the past 15 years, the injection has become more available. It's a very powerful tool, and what this injection does is it breaks down the collagen band, and the whole strategy of using that medicine. It's a very powerful drug. Is to inject it along the band, so you can later break it. You actually come back and you have to break it. I just want to say something about surgery or collagen injections or all treatments. It does not cure Dupuytrens. What it does is it takes care of the contracture. It helps improve the contracture, but it does not remove those cells that come and multiply there and then die and then contract. However, the present thought is that if you can get full extension on the fingers, then the cells don't want to multiply as much. So that's the goal.
Okay, I think I have a couple of minutes left. First of all, is there a limit then on how many of those injections you can have?
Well, there's a limit in time. You can get up to several injections within several months, and then that's usually very effective.
Okay.
But your long term, for the rest of your life, no.
Okay.
What I make the analogy is the injections it's like cutting back kudzu.
Okay, yeah. Okay, and then if you're somebody who has it and maybe you're hearing about this for the first time, so perhaps you've been dealing with this quietly for a couple of years, is early intervention key to success, or can someone come to you with a progressive condition and these injections can still be beneficial?
In most things, early intervention is good, but with Dupuytren's contraction, you have to wait until it's a little bit more established. If you get it too soon, it will just pour gasoline on the fire. So there's a test called the tabletop test, and if one can put their palm flat on the table, then that's a negative test. Then we wait a little. When the hands start to contract and they can't lay flat on the table, that's when we can do it, intervene. And whether you do it with surgery or with the collagenase injections, it doesn't matter. You still have to have a positive tabletop test.
Okay, so for folks coming to see you, do they have to have a referral from their primary care, or can they simply call your office?
No, they can just call my office.
Well, there is zero reason to put it off because the advances have become so beneficial. And like you heard him say, surgery is no longer the go-to treatment. So give them a call, 624-2696, online at sportmed.com. Dr. Bob Mastey, who we're talking to this morning, would love to help you. There could be a genetic component, or it could just be something that strikes you for no apparent reason. So good to talk to you this morning.
Well, thank you.
If your shower or bath is in desperate need of replacement, you're going to want to stay tuned, because today we're going to show you how West Shore Home can solve all of your shower or bath problems with their one-day installation.
That's right, Joe. So let's head out and take a look at what we're working on today. So this is common for a lot of the households that we come out to. It's the fiberglass shower and tub unit with a lot of exposed space up there at the top. You can see where that paint is peeling. That's because when the water